have a pretty gnarly headache today, actually a migraine. This would be another reason why I am looking into further palatal expansion and the breathing benefits, because a lot of times I'll wake up with really bad pounding sinus headaches that turn into migraines. I'm out of commission the whole day generally, and so it'd be nice to have less of these. Girl job! Today is the day that I pay Dr. Li. I'm going to call his office right now and give him a credit card number. And once I'm done with that, I'll explain to you the financials.
Dr. Kasey Li's office, this is Lori. Okay, perfect. I'll go ahead and do that, and then I will email you a copy of the receipt.
All right, thank you so much. I just got off the phone with Lori from Dr. Li's office. I paid the surgical fee, which is $30,000. It's a lot. I know. So to consult with Dr. Kasey Li, it is $500. I was under the impression that that $500 was applied to your surgery fee, but it's not. So do know that the consultation fee is separate and will not be applied to your surgical fee, which I do think is a little bit unfortunate. In the end, the fees mount up to $30,500, plus after I will be charged $400 again for more scans, and there's a $2,500 anesthesiology fee that I have to pay day of the surgery. So just like round up $35,000 for this procedure.
Wow.
I am very excited for this procedure at the prospect of breathing through my nose. It would be a miracle / dream come true if I could breathe through my nose. Like, that takes effort. I have to consciously force myself to do that. And even then, it is tight fit. I couldn't breathe at all through my nose last night, this morning, actually the last couple days. And for anybody that's a mouth breather, you know that when it's hot and dry outside, your mouth becomes really dry, and that wakes me up periodically throughout the night because I have to wet my palate. And it's kind of subconsciously I do that as I sleep, but sometimes it just gets so dry it wakes me up. And then that dryness then translates to headaches, and then the headache translates to a migraine, which is really hard to get rid of once I have one. I'm also a little nervous because, as I said in my last video, MSE was a really painful install, like very, very painful. And that whole weekend, I think I got it installed probably Thursday or Friday, and that whole weekend, I needed a lot of drugs to make it through that weekend. I was miserable, I had a lot of headaches. So I'm not entirely sure what ease will be like. It's not being attached to my palate the same way with the 4 screws as MSE. I'm not entirely sure how it's attached. We'll find that out as we go through this journey together, but I do know it's attached perpendicularly to the palate. I've also heard from a few other people that the ease recovery was pretty all right. It was decent. It wasn't rough. I'm hoping that's the case. I really am nervous for the pain. I'm also nervous for 2 other reasons. With MSE, the 4 screws and the device itself really cut up my tongue for the first week. My tongue was super swollen and sore. Of course, I got used to it, but that week was really rough, extremely rough. The screws especially, I would show my tongue, and then I'd have the 4 screw pattern dented into my tongue. And a second reason would be eating. Eating was really difficult after MSE, and I'll even add in swallowing. So swallowing, there were a couple of times where I wasn't sure that I'd be able to learn how to swallow with the thing in my mouth. Yeah, we'll see how it is with ease. So we are on a countdown. It's less than 3 weeks away, 2 weeks from this Friday, that I will have ease installed. I will see my orthodontist on Wednesday. I had a bracket fall off on the back, which is sort of devastating because my teeth like to pull this way. And so now I have more anchorage on this side, and it's been pulling my bite this way again. And if you were to know anything about my journey, you'd know that this has been the death of me for the last several years, this asymmetrical Tom Cruise tooth midline. And it's a hot mess. Just mostly when I see myself in pictures and video. Otherwise, I don't stress about it too much, but I would like to fix it because I didn't have this issue like before I went into braces. If you have any questions, let me know. All right, deuces.